There's a potential new treatment for COVID-19. According to the National Institutes of Health, a drug called Tempo could help reduce coronavirus infections. They say the treatment prevents the virus from replicating by impairing a key enzyme. While vaccines have been effective, health authorities say the treatments are still needed for people who are infected. For more on this, let's bring in Dr. Bob Lahita, because it's Friday, and he's also the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health, and we see you every Friday, Dr. Bob. So it's good to see you.
We do.
Happy Friday, Vlad.
So what do we know about this drug, this antiviral drug, and explain to our audience how it works?
It's a wonderful new advance. It's called Tempo, and it blocks an enzyme called replicase, RNA replicase, which is very specific. And this RNA replicase really blocks the replication or the development and of the virus, of the COVID-19. You know, when this particle gets into cells, it replicates with regard to the messenger RNA. It becomes the spike protein. This blocks that. It blocks the infection, actually, so the virus has no effect on the vaccine, but it does block the viral infection. It's useful particularly in the salivary glands and in the lungs, where this virus gains and gets hold and causes bad stuff.
The CDC is warning of a rise in the number of young people being hospitalized with COVID-19. I suppose it sort of makes sense if older people are the ones getting the vaccination, they're less likely to obviously contract the vaccine. But at the same time, health authorities are investigating a rare heart reaction seen in a handful of teens and young adults after they received the second dose of the vaccine. Can you tell us a little bit more about this?
Yeah, Anne-Marie, this is called myocarditis, and it's fairly common among young people now. And we see it when you get infected with 19, and now we're seeing it when you get the vaccine. It is not necessarily proven to be linked to the vaccine. Not permanent. It occurs in young men, mostly 18. And this transient, mostly male heart inflammation is very, very temporary. And some of the males that have had it will complain of comfort, which eventually goes away in a couple of days. So this is something that's not proven to be linked to the vaccine, but it's currently being studied.
Let's just, for our audience, to know that we're having a little bit of an audio issue with you, Dr. Bob. I think it seems to be working itself out. But again, while we are still opening up and things are slowly coming back to normal, many of us are still doing these live shots remotes, which means that there will sometimes be technical difficulties. So let's talk about the pace of COVID-19 vaccinations, which has slowed in recent weeks, especially in southern states, Mississippi, Louisiana, Alabama. They have the lowest percentages of adults who've received at least one dose. In your estimation, has the nation's mass immunization efforts stalled? And do you think that we will ever get to the 70% plus that the president is hoping to achieve by July 4th?
I think, Vlad, that we will get to herd immunity, but not necessarily by July 4th. At the rate we're going, you know, we're going to be at about 68%. There are a lot of states, 30 states to be exact, that are behind in vaccinations. And many of those you saw on the map you just showed, which is Alabama, Mississippi, Wyoming, Louisiana. The Northeast, believe it or not, is pretty well vaccinated. The far west, like California, is pretty well vaccinated. But there are a number of states that you see on your map there that are not really reaching anything beyond 63 to 68% at any one time. So we're not going to reach 70% herd immunity with those 30 states that are behind at the present time.
Doctor, I hope that the audio maintains itself. Just for this last question, this is not a COVID question. There's an international study on a drug sold by AstraZeneca and Merck. It appears to reduce the recurrence of breast cancer in women who have had an early but aggressive form of the disease. This sounds really important. What can you tell us about this pill?
Yeah, this is very important, Anne-Marie. breast cancer pill is called Lynparza, and it really decreases the recurrence of breast cancer by 42%. It is what we call a PARP inhibitor, which stands for a very big name, but suffice it to say that it blocks the cancer cell's repair of its own DNA. Now, there are certain women out there with BRCA, BRCA mutations, and they know who they are. Generally, BRCA runs in families, so you get breast cancers and ovarian cancers, and this drug blocks the cancer cell's repair of its own DNA and decreases the recurrence of the BRCA tumors. And that's really, really important, and it's a major advance. So I'm very excited about that, as I'm sure you are.
Yeah, I mean, it sounds like something that could be a game changer. We had a couple of audio hiccups, but I think the gist of what you said came through loud and clear, Dr. Bob. Thank you so much. You have a good weekend.